And now we are going to discuss a topic called the peptic ulcer. In that, first let us discuss the definition of the peptic ulcer. In order to explain any definition, first we need to explain it briefly and why is it causing and what are the signs and symptoms of that disease. And this is it is defined as disruption of the mucosal integrity of the stomach leading to local damage due to acute inflammation caused by H. pylori or excess acid secretion, which is characterized by stomach irritation, vomiting, nausea, and then GI bleed. Before understanding how this etiology all this occurring, first we need to understand how the acid production is occurring. For this, I have a diagram for you. In this, we have two types of actions for producing acid. One is the direct pathway and is the indirect pathway. And in direct pathway, first thing, direct pathway, the acetylcholine, gastrin, and the histamine stimulate the parietal cells, triggering the secretion of the H plus into the lumen. Okay, these are the parietal cells here, and this is the ECL, which is nothing but the enterochromaffin like cells. This is the which is the part present in our stomach. In direct pathway, acetylcholine, gastrin, and histamine stimulate the release of stimulate the parietal cells and then triggering the secretion of H plus into the lumen. And there is one more thing, that is an indirect pathway. The indirect pathway, the acetylcholine and gastrin also stimulate enterochromaffin like cells, resulting in secretion of histamine, and this histamine then acts on the parietal cells, thus activating the H plus K plus pump and releasing the H plus ions into the lumen of the antrum. And by this, when there is a presence of the chlorine within the lumen of the antrum, this H plus ions interact with that of the chlorine and then forming the acid in the stomach. This is the normal process occurring in our stomach. And what are the etiopathophysiciology of causing this peptic ulcer disease? And this can be explained in the two ways, which are common and uncommon. There are two types, that is etiopathophysiciology we are going to discuss now. Etiopathogenesis. Okay. And coming to in this first one is common causes and uncommon causes. In this common, the first thing, well-known cause for this peptic ulcer disease is Helicobacter pylori infection, which is also known as H. pylori infection, and non-steroidal anti-inflammatory drugs, NSAIDs, and stress-related mucosal damage. And these are the common causes for occurring of a peptic ulcer disease. And there are some uncommon causes. There are Zollinger Ellison syndrome, radiation therapy, smoking, smoking, coffee, and alcohol. And let us explain all this in detail one by one. First thing, let us come into the H. pylori infection. H. pylori, just write in a tabular form. H. pylori infection. What is this H. pylori first of all? This H. pylori is a spiral shaped gram negative bacteria, and it also has a flagella. And with the help of this tail, with the help of its tail, it enters the superficial mucosal layer. Initially, H. pylori neutralizes the acid in the neutralizes the acid by producing large amounts of urease, and this urease breaks the urea present in the stomach to carbon dioxide and ammonia. Okay. And then this H. pylori infection, which is also can be HP infection, causes atrophy of the oxyntic glands, the oxyntic glands, then causing the gastric acid secretion declines. What are these oxyntic glands? First of all, these are also the glands similar to that of the parietal glands present in the stomach, but these oxyntic glands are found in the fundus of the stomach, fundus and also the body of the stomach. Yeah, and next, this H. pylori organisms are capable of attaching to gastric epithelial cells and are responsible for triggering the production of pro-inflammatory cytokines such as interleukin, or interleukin 8, interleukin 1 beta, and tumor necrosis factor TNF alpha. The and these inflammatory mediators can also cause the damage, can damage this epithelial cells, including parietal cells, and this could have an effect on acid secretion. However, the presence of these cytokines as a direct inhibitory effect on the acid secretion, as the interleukins which are being produced, they are the interleukin 1 beta is the most powerful acid inhibitor. Okay? And the TNF alpha is also having the acid inhibitory properties. And we know that this H. pylori infection is causing the peptic ulcer disease, in which the acid production will be more. Till now, we have discussed everything regarding the decrease in the acid production, how this H. pylori initially causes a decrease in acid production. And after the initial stages, this H. pylori causes the increase in acid production. If the H. pylori can cause two types of damage to the damage to that of the stomach. If this mechanism follows in a patient, then this patient will be more prone to gastric cancer. Okay, and coming to one more mechanism we have, that is we have the H plus K plus ATP ACE pumps that are involved in final stages of gastric acid production and are stimulated to secrete acid by signaling from the H2 receptors, muscarinic M3 receptors, the gastric receptors, and the parietal cells. This H. pylori activates these pumps and thus causing an increase in acid production. Okay. And coming to the next one, we have that is non-steroidal anti-inflammatory drugs, that is NSAIDs, and how these drugs are causing increase in acid production. There are two types of defense mechanisms present to protect the mucosal layer. On which these NSAIDs are damaging this mucosal layer. That is the prostaglandin dependent NSAID induced injury, and PG, that is a prostaglandin independent NSAID induced stomach injury. Two categories. One is the prostaglandin induced, the prostaglandin dependent NSAID induced stomach injury. In this, since prostaglandins play a critical role in the maintaining the mucosal defense mechanism, the inhibition of the COX enzyme leads to decrease in mucosal prostaglandins and is considered to be the most important of the pathogenesis of NSAID-induced gastric damage. And we know that the aspirin, which is an NSAID, inhibits the COX enzyme irreversibly, while the other NSAIDs inhibit the COX in a reversible manner. There are two types of COX enzymes, so that is the COX-1 and the COX-2. What are these COX-1 and the COX-2? The COX-1 is responsible for the maintaining the mucosal integrity, and the COX-2 is participating in the inflammatory activities. Okay, and these NSAIDs mainly inhibit this COX-1, as its function is inhibited by NSAIDs, as its main function is to protect the mucosal integrity. Because of this damage to the COX enzyme, there is no prostaglandins is being synthesized, and thus we will lack a mucosal damage. And the second category for causing this mucosal Stomach injury is the prostaglandins independent NSAID induced stomach injury. In that, we have a theory called as the trapping theory. Theory is called as trapping theory. Okay, this the mechanism is um, the mechanism of NSAID induced mucosal injury that is not dependent with systemic prostaglandin deficiency includes local injuries of these agents. Most of the NSIDs are weak organics, weak organic